The hip joint is one of the largest joints in the human body. It allows us to flex, extend, and rotate with ease, much like a ball bearing joint. Full function of the hip joint is dependent on the successful coordination of many integrated parts, including bones, muscles, tendons, ligaments, and nerves. The hip joint is one of the body's largest weight-bearing joints. It consists of two main parts: a ball or femoral head at the top of your thigh bone or femur that fits into a rounded socket in your pelvis or acetabulum. Bands of tissue called ligaments or hip capsule connect the ball to the socket and provide stability to the joint. The bone surfaces of the ball and socket have a smooth, durable cover of articular cartilage that cushions the ends of the bones and enables them to move easily. The hip joint is surrounded by a smooth lining referred to as synovium. This lining secretes a small amount of fluid that makes your hip joint move without friction. Normally, all of these parts work in harmony and allow you to move freely and without pain.
You may ask why joints such as the hip, knee, ankle, shoulder, and elbow would require joint replacement subsequent to injury. The reason is these joints are under constant demand for performance. The tissues and fibers within the joint may be injured or simply wear out with time. The most common reasons for joint replacement are persistent conditions of pain, restriction of movement, severe fractures that crush the bone and cartilage, deterioration, or destruction of the joint due to chronic arthritis, or some degenerative disease such as osteoarthritis, rheumatoid arthritis, avascular necrosis, or post-traumatic arthritis. Improvements in joint replacement surgical techniques have greatly increased the effectiveness of total hip replacement. Today, more than 200,000 total hip replacements are performed each year in the United States.
The artificial hip joint is called a prosthesis, and it is designed to provide painless, functional range of motion for the patient. During total hip replacement, both parts of the hip joint, the ball and the socket, are removed and replaced. Usually, a titanium metal shell is placed into the patient's hip socket. A metal ball replaces the femoral head, and a metal stem is inserted into the patient's canal onto which the ball is connected. To achieve a successful total joint replacement, you need to realize that we must work as a team. You are an important member of that team, and actually the work you do during the rehabilitation process is one of the most important factors in obtaining optimal results.
Your surgical procedure may take from 1 to 2 hours depending on the complexity of the case. Total hip replacement is a major surgical procedure, and as with all surgeries, there is the risk of potential complications such as bleeding, blood clots, damage to nerves and blood vessels, and persistent pain or infection within the joint. Infection can occur despite proper surgical procedure and medical treatment. Precautions include preoperative antiseptic scrubs and washings of the leg and hip prior to surgery, as well as administration of antibiotics and appropriate wound care postoperatively. As with any joint replacement, there is a slight chance of prosthetic failure. This may be caused by dislocation, excessive wear, or excessive weight of the patient. Overweight patients are advised to lose as much weight as possible prior to the surgical procedure, as well as keeping the weight off afterwards.
Hip replacement surgery offers several benefits. First, it reduces your hip pain. You should expect the hip pain you experienced prior to surgery to be either dramatically reduced or completely eliminated. Secondly, it restores lost mobility. As your hip pain lessens and you follow your physical therapist's recommendations, your leg will become stronger, meaning less fatigue and easier movement. Thirdly, it improves your overall quality of life greatly. With less pain and greater mobility, you will be able to perform your daily tasks more easily and lead a more active, independent life.